I think it's worth going back a moment to during the pandemic and how it changed then. So I think prior to the pandemic, it was really looking at and working with all aspects of the community and over so many different things, mental health and homelessness and substance use disorders, and I mean anything really does affect population or the public's health. And I feel like during COVID, it really got down to one thing. It was communicable disease control and prevention, and how are we going to get everyone through this pandemic? And it was really quite focused in that area. And I think people maybe think that's really what public health is, but it's so much bigger. And I think we're getting back now to where the health officer and the role is really facilitating meetings and collaborations and interactions between the health and the government, local government, and the larger community. And so that's really exciting part of coming out of the pandemic, kind of getting back to some of those bread and butter public health and health officer roles, and getting out of just communicable disease prevention, which is important, but all of the other things that affect a population's health and well-being. I think right now for the health department, it's kind of doing a reset with the community on what we do and their expectations a little bit. Again, I think a lot of people didn't really know what public health or a health department did from day to day prior to the pandemic. And the only taste that they got was issuing orders and telling people what to do, and restricting some of their activities and things like that. And now I think we need to hit a pause and a reset and say, hey, this is what we offer. We offer so much more than just that. And actually, that's not the bulk of what a health department or public health does. It's a very small part. So, hey, here's our resources. This is what we do. These are our services. This is how we work with other people to really, move the needle on improving health outcomes. I think we have to build relationships. More than one county that I have either worked in or I've talked to their health officer or their health department, they didn't have a lot of the relationships built in advance. And so a lot of us were building them as we were going on during a pandemic, and that's not the best time, but it worked. And so I think we really need to keep building those relationships and fostering them. So we've got, we know the people we're interacting with that we need for this and that, and how we can collaborate and really improve things. And then hopefully there will not be another pandemic anytime in the near future, but with, different natural disasters and other things that can come up, we already know each other. And we know what we can do, we know how we can work together, and we trust each other, and we can work together to move things forward, and no matter what's happening. What drew me to San Mateo County was that everything I've read and different people I've spoken to really feel like the community as a whole cares about the health and well-being of everyone in the community. And you may take that for granted, but that's not always the case. But it just seems like everyone from our elected officials to our community-based organizations, our promotoras, people walking down the street really do care about improving the health of everyone here. And that's a really great place to live and work if you can do that. And so that's what really excites me about San Mateo County. And I'm looking forward to meeting all of those people who want to move that dial and meet those goals.